Marshall Smith, Alberta's effective approach to drugs. Remember when everyone was freaking out about this a year ago? Was it a year ago on this show? We were talking
Oh, I
about how
wanted.
we were going to kill all the fucking junkies.
No, we
and
need to do a show on this. We need to do like a full interview with somebody on this.
Yeah, so the numbers are out. Alberta's effective approach to drugs should be a North American standard. Again, Alberta leading the world. In 2024, opioid deaths in the province decreased by 38%. 4 out of 5, or sorry, 2 out of 5 less. The drug epidemic and addiction crisis have quickly become a defining issue of Canada's relationship with the United States. President Donald Trump is committed to implementing a 25% tariff on all Canadian goods, citing a need to stem the flow of deadly and highly profitable drug fentanyl between the countries. Canada and the United States have seen a consistent increase in the usage of the drug over the past 10 years, along with increased manufacturing, trafficking, and dealing of this deadly poison. Well, this issue has taken center stage. Different approaches for addressing drug trafficking and addiction have been tried across the country for years now. As of now, only Alberta stands as a clear example of a jurisdiction in Canada where opioid overdose deaths were down 38% in 2024, a decrease larger than anywhere in North America. I will add that that is while the economy was falling off of a fucking cliff and unemployment was at an all-time high for the last 20 years. Why? Because Alberta has effectively merged law enforcement and addiction treatment efforts to tackle both the supply and demand for illegal drugs in a fair, firm, and compassionate way.
What a concept.
When it comes to reducing the supply side of the drug issue, law enforcement efforts play a vital role. While many activists call for the removal of police from this conversation entirely, this simply does not work. Police and corrections involvement, intervention, and consequences must be a significant part of our efforts. Alberta has stepped up by working with national and international agencies to crack down on the production and trafficking of fentanyl, enhance border security, increase surveillance, and coordinated raids on drug labs are just a few measures the province has taken to disrupt the flow of illegal drugs. Local police forces are also working hard to dismantle drug trafficking networks within Alberta. By targeting dealers and suppliers, law enforcement aims to cut off the distribution of fentanyl at its source. The more disruption of these criminal organizations, the better. Can we arrest our way out of the addiction crisis? Of course not. But decriminalization schemes and the normalization of hard drug use has been a sickening failure and has contributed to a dystopic scenes that we see in cities across the country. On the other side, you have the users who drive demand. Reducing that demand is essential to any credible drug strategy. And this is where Alberta's approach truly shines, getting people into recovery. In the first 9 months of 2024, opioid-related deaths are down 38%, a feat unmatched in North America. Alberta is 5 years into a 10-year strategy of building a recovery-oriented system of care to disrupt addiction, deliver comprehensive treatment, and support long-term recovery. By partnering with law enforcement, Alberta delivers addiction treatment the moment someone is arrested. When individuals arrive in police cells, a health assessment is conducted, and if eligible, treatment medication like Sublocade is offered. Use is voluntary. Sublocade reduces cravings and withdrawal symptoms for opioids, tricking the brain into thinking it has received an opioid without producing euphoria. Sublocade is an injection that lasts 30 days in the patient. It's wide available in Alberta as a game changer. This approach does not absolve criminal responsibility, but combines healthcare and law enforcement to deliver better outcomes. You don't have to have a run-in with the law to get help. The province has introduced on-demand access to opioid agonist therapies like Suboxone and Sublocade. Suboxone, probably. And Sublocade. Today in Alberta, anyone can call the virtual opioid dependency program and get same-day access to these life-saving medications without fees or wait lists. In a world where people who need help the most get the least, and those who need help the least get the most, Alberta has sought to turn this reality on its head. In its correctional centers, Alberta has built a network of therapeutic living units providing high-quality mental health and treatment to incarcerated individuals. These units offer the best, most intense treatment available. Alberta's pioneering correctional therapeutic living unit programs offer life-changing opportunities, helping individuals avoid relapse and reject a return to criminal activity upon release. Alberta has also increased access to all forms of addiction treatment. Over the past 5 years, funding for bed-based addiction treatment has increased by 50%, allowing 10,000 more people each year to access detox treatment and recovery support. Additionally, Alberta is investing $350 million to build 11 brand new world-class recovery communities. These long-term centers range from 50 to 100 beds, provide comprehensive addiction treatment with a focus on helping people rebuild their lives. Blah, blah, blah.
Yeah.
Alberta's efforts are a powerful example of what can be achieved with a firm and compassionate approach to drugs and addiction. The drug and addiction crisis, and now our relationship with the United States, and bold solutions.
Yeah, that's great. I mean, honestly, I've been meaning to get one of the experts on the show about this because I do think they're doing it the right way. I mean, you got to be firm and get people into treatment. You have to get people into treatment. This harm reduction thing is not working. Like, there's people that can defend it all day long, but it's harm. There's harm. Harm is increasing. Whether you talk about the community, the law enforcement, the people themselves, the ODs, like it's all going the wrong way.